This is another model that the authors point to as a way to kind of understand this concept of criminal justice risk is much more than mental illness and lack of access to proper treatment for mental illness, but rather, using their words, a confluence of these predictive individual, in this case, individual level factors that, using their words, elevate the risk of offending behavior. So history of antisocial behavior and antisocial personality patterns. So if there's certainly, when people engage in destructive, violent behavior, um, that whether they end up in the criminal justice system or not, um, these are behavior and personality patterns, if you will, that become cyclical and repetitive, and and um, and they come from uh, thinking and attitude. So we have stress that weighs upon people, um, and all those different aspects of stress that we talked about, and that influences the way people view the world, whether they view it in a very positive, or I don't know why I'm trying to draw a globe here. So sorry, I just start doodling when I'm talking. Um, that these stressful circumstances, like poor social relationships, poor social support, uh, poor access to education and employment, um, poor access to leisure and healthy leisure and recreational activities, right? Um, if there's no park to go play in, or if the park that does exist isn't safe to set foot on, then you're much more likely going to sit in a dark room and play video games and smoke marijuana, as a for instance, right? So, and again, when you have when you have problems in these areas, you're much more likely to uh, use substances of abuse to cope, and these all kind of create a very negative thinking and attitude towards the world, and then those thoughts and cognitions and attitudes influence behavior and then become personality patterns. So that's and this is all kind of just my interpretation of the Central 8 model. So, um, and the authors also point to data that, in their mind, it seems very clear that criminogenic risk, these risks, these things that are associated with risk for criminal justice involvement, are equally prevalent among those who do get involved with the criminal justice system, equally prevalent among those individuals who have a diagnosed mental illness and those who don't. So to restate that, folks who have uh, when you look at people who have a known diagnosis, and or getting treatment, or I'm sorry, if they have a known diagnosis and perhaps are even getting treatment for that mental illness, and then you have another group of people involved in the criminal justice system who have no known diagnosis, no evidence of a mental illness, and are not getting treatment for a mental illness. Those two groups within the criminal justice system have little to no difference in terms of the influence and the prevalence, using their words, of these risk factors as related to their criminal justice involvement. Um, so, and I put these in bold here just because they're kind of concluding and statements. Is that, and I'll just read what they wrote: for people with serious mental illness, ignoring their co-occurring criminogenic needs may constrain treatment effectiveness in a way that's analogous to ignoring their concurrent substance abuse problems. So, and I think that is a great analogy. So, if you have, and I talk about this in the psychopathology class a lot, right? You have somebody with depression and they're using alcohol, even if it doesn't qualify as a use disorder by the criteria, but they're using alcohol to cope, to treat their depression on their own, if you will. If you don't acknowledge that and incorporate alleviation of that use of alcohol, or at least great reduction of that use of alcohol as part of the treatment plan, you will not have good outcomes. That person will not experience a reduction in their depressive symptoms. They just won't. And so, how this analogous here, quoting the authors, is if you have someone who has a known mental illness, and let's assume that they mean an addiction illness as well, and you attempt to treat that with the purpose of reducing their risk for criminal justice involvement. And you, just like in the case of a person who's got alcohol and depression, and you're ignoring the alcohol, if you ignore all these, just like that person with depression and alcohol use disorder, or even alcohol use, you will not have the outcomes you're looking for. And so, in this case, you will not reduce the risk of criminal justice involvement if you are just providing mental health or behavioral health care and ignoring these criminogenic risk factors. So, um, and so that's the kind of bottom line assertion of the authors of this article, which I agree with, and why I really enjoyed this article and kind of put it front and center in this lecture. So I pulled out a data point that the authors included about substance use and criminal justice involvement. So, in citing some research from 2006, the authors stated that 75% of those in prison or jail and had a known diagnosed history of mental illness um, also met criteria for substance dependence or abuse, or what we would know as substance use disorder in DSM-5. And uh, there was drug use prior to the arrest, much more commonly um, than uh, than among those with known mental health problems than those without. So, in other words, if someone has a known history of mental illness, they were much more likely to have drug use or intoxication as part of the factor in their arrest than those who did not have a known history of mental health problems. And three-fourths of those, whatever sample size they study, three-fourths of those people in prison or jail who had a known diagnosed history of mental illness also met criteria for substance use disorder at the time of their arrest. Okay, so here's another assertion from the authors based on their research, talking about behavioral patterns and personality traits and the risk of criminal injustice. So, um, so according to the research that they had, that they call, and they call these behavior patterns and personality traits, um, but these are things that are common among people with and without a known history of mental illness, addictive personalities, and not necessarily uh, exclusive to drug addiction, but gambling and other maladaptive, or unhealthy, maladaptive is the wrong word, unhealthy repetitive behavior patterns. All right, so that can be, uh, you know, pornography, internet addiction of all different flavors. People with addictive personalities tend to, or kind of addictive repetitive behavior patterns, probably more accurate. Sorry about that. The voice thread cut me off in the middle of the last audio clip. So, getting back to our list of these behavior patterns and personality traits of criminal justice risk: novelty seeking, or risk taking, if you will, a kind of urge, a kind of unmitigated or poorly mitigated urge for instant gratification, meaning we all like instant gratification to one extent or another, but we have our frontal lobe and our higher functioning areas of the brain to help us mitigate that, right? What Freud used to call a superego, right? And other compulsive behaviors. So, kind of addictive, unhealthy behavior patterns, high risk um, propensity, poor ability to mitigate need for instant gratification, and other compulsive and unhealthy behaviors as a repetitive and and unhealthy. So these are all things, kind of behavioral and personality concepts that increase the risk of criminal justice involvement. And of course, and then really the point that they're making here is that persons in the criminal justice system share these risk factors equally uh, among those who have a known history of mental illness and those who do not.